back to my channel. For those of you that are new here, my name is Rami, and if you are new here, welcome to this video, welcome to my channel. Go ahead and click that red subscribe button. Today's video is going to be very fun. I have Sarah here. We graduated nursing school together, and she is a pediatric nurse. So I thought it'd be kind of fun to do a nurse Q&A of a pediatric nurse versus like an antepartum OB nurse, because we were just talking about it, and I know we were both really interested in both specialties. I was really interested in women's health and pediatrics, and she was as well. So I thought it would be a really fun video if you are interested in getting into one of these careers, just to do a Q&A and kind of see what we do kind of every day and how the specialties differ. So let's get started.
So my name is Sarah. I work at a pediatric hospital. I've been there for a little over 2 years now. And the unit that I work on is mostly an endocrine unit. We do get med-surg patients too, so we get a whole bunch of different diagnoses like diabetes and hyperinsulinemia, hypothyroidism, and then things like the flu and RSV and everything in between. We kind of see it all.
So you guys kind of know about me already. I do work on an OB-GYN unit, but we're primarily an antepartum or high-risk antepartum unit. So we mostly get pregnant patients with any kind of problem, whether that is the flu all the way to if they're PEPROM'd or if they're ruptured, all the way to if they're bleeding. We get all kinds of problems. We get long stay pregnant patients and short stay pregnant patients. So we kind of get a whole wide spectrum of things. We do also get high risk postpartum, so I do get to take care of babies as well. And we take care of the GYN aspect of OB-GYN, so we take care of surgeries like hysterectomies, if they had their tubes tied, things like that. We also take care of oncology patients as well. We do have a wide range of things on our floor. So we do take care of oncology patients or cancer patients that have feminine cancers, cancer origins, such as ovarian cancers, endometrial cancers, uterine cancers, things like that. So those are the kind of patients I take care of on a daily basis, but we are primarily an antepartum floor. So we both graduated nursing school together, and we both got into residency about the same time. These days, it's really hard for a new grad to find a position in nursing if you don't go into residency. So typically residency is a one-year program that helps transition the new grad into the role of a nurse. So we both got into residency about the same time. We had nurses from all over get into the same residency, and what we kind of did in our residency was go through like our skills. So like we reviewed like IVs, catheters, bedside skills, like going in there and introducing yourself. We did the very basics from the beginning. From then on, we kind of did things like, of course, learn how to use like the charting system together, and just learn about the hospital together, like the mission, and the CEO came and talked to us. We had lots of guest speakers come and talk to us about the hospital. And then towards the end of residency, towards the 1 year mark, we did do a project. We got in groups and did a project about something that we were really passionate about. So of course, I got in a group with like labor and delivery and a postpartum nurse, and we got together and did like an OB project. But yeah, so basically every week we would go in for like a 4-hour period and kind of talk about like what we've learned, and it was kind of like a safe space to kind of talk about anything that went wrong, anything that you had concerns about, and we had like mentors and experienced nurses come and like talk to us and kind of help us through that. So it was really nice. I kind of liked the transitioning because it is scary as a new nurse going into a brand new field. You know, you learn all these things in nursing school, and here you are expecting to take care of 6 patients. So that's how our residency program kind of went.
Yeah, ours was kind of the same way. Ours was a year-long program also. The first 6 months were kind of full of classes. We rotated through 4 different units. And then the last 6 months we were actually placed on a permanent unit, where we had to be for at least that 6 months. If we wanted to transfer after the 6 months, we could do so. But otherwise, like, I've been on my same unit since I've been placed there. Ours was a little bit different in the fact that we did all meet up together, but when we applied for the residency, there are 3 different tracks you can choose from. So you can either choose to do critical care, you can do med-surg track, or you can do like peri-op track. And so I chose to do the med-surg track, and so the 4 units that I rotated through were 4 of the many different med-surg units that we have on the unit, as opposed to the critical care track. We'd rotate through our critical care units, and peri-op would do the peri-op stuff. So we did a lot of classwork, we had a lot of guest speakers, a lot of educators come talk to us, we had a lot of case studies, a lot of scenarios that we worked through and we talked about. We would do kind of the same thing where we would talk about things that we had seen kind of in a private confidential area where we could just express our feelings. There were a lot of tears, there was a lot of laughter, there was a lot of connecting with the different classmates and things like that, and our cohort was really close and we would do different things together, and we're still friends with each other now, so it was a really good experience. I really recommend doing a residency if you can. I know they're really kind of competitive and maybe a little bit hard to get into, but if you can at least try and do it and get in, it's a great thing.
So the next question is, tell me about a typical day on your unit.
Okay, so I work night shifts, so I clock in to work at 6:24 p.m. Not a minute.
6:24?
Yeah, not a minute sooner.
Why? It's so early. It's 6:30?
That's as early as we can. 6:24 to 6:36.
That's our time frame. Wow, okay.
Yeah, so I clock in and I make my way up to the front of the unit, grab my sheet with my patient assignment on it, and find the nurses to get report and get my night going. Once I get my patients and we do report, I usually sit down, gather my thoughts together, kind of plan out my night and see how it's going to look, how busy it is, and what my priorities are. And then I get going, doing my assessments, doing my vital signs, visiting my kids, seeing how they're doing. Okay, so with our diabetic patients, usually how the night goes is during the day at breakfast, lunch, and dinner, the daytime nurses, the day shift nurses will typically do their insulin and their carb coverage and all that good stuff for them during the day. For us at night, since they've typically already gotten their dinner and things like that, we usually do a 9 o'clock bedtime insulin or blood sugar check. If they're high, we'll give them some insulin, offer them a carb snack at that point if they're able to have one. And then sometimes we'll do a midnight check just to make sure that they're not running low through the night. And then we'll do another 4 a.m. blood sugar check and correct at that point if they're running high too. And we're usually responsible for getting their breakfast order so that we can order as soon as 7 a.m. hits and we can call down to the cafeteria, but I'm really bad about that, so sorry day shift nurses. Day shift are diabetic patients if they're newly diagnosed diabetics. They'll get 2 full days of education, so the diabetic educators will come by and see them, as well as a nutritionist. A clinical therapist will come by just to talk to the family about the new diagnoses and see how they're doing and how they're coping with it. Social work will come see them, see if they have any needs and if they need any assistance with anything.
So usually we get report around 6:45, and then from about 7 o'clock to like 7:20-ish, I'll sit down and look at all my patients and prioritize to see who I have to go to first. Usually I'll do my assessments around 7:30. I usually get done with my assessments around 8:15, and then usually around 9 o'clock we give scheduled medications. Usually antepartum patients won't need that many medications, whereas postpartum patients do need a lot of pain medicines. We don't give heavy narcotics or anything like that to them. Whereas our oncology patients, we do give heavy narcotics too, and our surgeries such as morphine, Dilaudid, things like that. So it kind of just depends on the patient I have. We do take vitals every 4 hours. I do take a set of vitals with my assessment, and then at midnight and 4 o'clock. Postpartum patients do need less vitals depending on how long their stay is. So usually my day kind of starts out depending on what kind of patient I have. If I have an antepartum patient, I'll usually have to put them on the monitor first thing in the shift. Whereas if I have a postpartum patient, I'll have to assess the baby, assess the mom, and kind of assess like their situation. Oncology patients usually need a little bit more care because they are more pain control. So I do plan out my shift depending on the type of patient I have, like how often and how frequently I'll have to be going in there and assessing them, and kind of which patient I would go to first. I kind of prioritize them. It just depends every day. But yeah, that's kind of how a typical day on my unit goes. It varies. So the next question is, why did you choose this job?
I chose to work in the pediatric field because I've always felt more connected to pediatrics than, say, geriatrics or different set of age groups. Probably because my mental status is that of a 5-year-old, so we get along really well. I just love working with kids, and they're a lot of fun. They're always happy no matter what's going on. You're able to comfort them and kind of be with them and play with them, as well as taking care of them and helping them get better and sending them on their way home.
Okay, well, I chose this job. I was really interested in pediatrics, but my interview process kind of went more towards the women's health, OB aspect, so I was down for that. I did really enjoy all my OB clinicals. I did my clinical specialty in OB as well, so that kind of made me love the job even more, and I just had a passion for it. I did really want to get into labor and delivery actually, and my interview was actually for labor and delivery. The spots were limited in residency, so they put me in antepartum, which they had an open position for. So that's kind of how I ended up on this unit, but I ended up loving it. But I really did want labor and delivery because of the aspect of bringing a new baby in this world, a new life. It's a miracle, and of course it really made me passionate for it. So I did really want labor and delivery in the beginning, but I kind of found myself in the OB unit. So that's kind of why I picked this specialty, and I really do love it. So the next question is, what do you find most rewarding about this job?
The thing that I find most rewarding about my job is just being able to care for my patients, for my kiddos and their families. It's a wonderful feeling once, like if a kid draws you a picture or something like that and thanks you for everything that you've done for them, and they give you that kind of as a thank you, even though, you know, it could be like a 2-year-old's crayon scribble or something like that. It still means a lot because it came from the heart. And just being able to care for them and be with them and helping them through a hard time in their lives.
True. That's a good one. I'll play off that. It is hard, of course, for anyone being in the hospital, so it's awesome to be taking care of, patients in general, no matter what unit you're in as a nurse. It's awesome just helping people when they're sick. The rewarding part of my job is, I'm just going to use an example of my antepartum patients because it is a little happier towards that patient population. They are, they're pregnant, they're going to be having a baby soon. So I guess we do inductions quite a bit. So I guess the awesome part is kind of inducing them, sending them to labor and delivery, and then sometimes we get them back and seeing the little miracle that they delivered. So that's really rewarding. So the next question is to kind of talk about the hardest part of our job.
It's a deep question.
Mm-hmm.
It's a deep question. Nursing is not an easy field. For those of you who are already nurses, you know that to be true. And for those of you who are going to be nurses, it's not all glamorous as sometimes it appears to be on TV, or when people post like happy posts about being nurses and things like that. There are some really hard things about nursing. I think one of the hardest things about being a nurse is just seeing how sick our patients can be. I think one of the harder things too is seeing, or hearing sometimes about if you get a new patient and you have to take their medical history and their social history. Sometimes those social histories can be really heavy, and it can be hard to imagine what some of these patients have really gone through in their lives. And so sometimes you can see the situations that they're in and how it's led them to be in the hospital, at that point in their lives. And just kind of seeing that can be really hard. And you feel really sad for the patient. And I think it's important seeing the hard things at work and being able to have that empathy and be sympathetic towards your patients, and at the same time not always bringing it home, because once you take it outside the workplace it can really be heavy on your heart. And so it's important to kind of keep work at work. And that's not saying not to, that you can't care about the patients and you can't think about them and pray for them and hope that their lives get better and things like that. But just keeping that boundary so it's not tearing you down and it's not giving you burnout either.
So yeah, a big part about nursing is also being there for the patients. A good majority of our patients, probably like 99% of our patients, do need a lot of emotional support and a lot of emotional care. Lots and lots of patients I get do not have family members with them, do not have any kind of social support. So it's really, really hard on them. And we are expected as nurses to be there for them for emotional support as well. And that takes a big toll outside of our medicinal role of giving them medications and assessing them and making sure they're clinically okay. And we also have to make sure they're emotionally okay. And I think that's one of the hardest part of our job, especially dealing with oncology care and end-of-life care. That's also a really big thing. Kudos to you if you are a hospice nurse. I don't know how you could do it, but yeah, it is really hard. The next question is, what is the most fun thing about your unit?
That's a good question. One of the most fun things about my unit is first off, the attire that we get to wear, our required work uniform. We don't have to wear a certain color like most nurses do. In the pediatric hospital, we get to have fun because we like having fun.
They get to wear shirts.
We get to wear t-shirts with our hospital logo on it. And we can wear anything that's child friendly. So right now, as you can see, I'm wearing a Wonder Woman scrub top. We can wear anything that we want. And so even on the holidays, like for Christmas, the nurses that work Christmas Eve night got to wear pajamas to work, which is really cool. That would be really fun. And on Halloween, we get to dress up and we get to wear different costumes and things like that. So that's always a lot of fun too. But of course, just being with the kids, it's never a dull moment. They're always doing something funny, or you always have a good story to tell about them. So
that's fun. Yeah. Well, we don't get to wear fun scrubs like them. We do have to wear this royal blue color of scrubs every single day. One of the fun things we do on our unit is plan baby showers for our pregnant patients, especially the ones that are there for a long time. Usually those are like the patients that have ruptured early or their water has broke early. So we do plan fun baby showers for them, and we surprise them, we decorate the break room. It's usually a fun thing for them because it gets really emotional and we grow really close to those patients that are there long term. So it's really fun to do that. So yeah, we love planning baby showers for our patients. It's one of the most awesome things to do, and it's really rewarding getting to see their baby after we've monitored it for so long. So yeah, we enjoy doing that in our unit. So our last question is going to be, how do you handle the stress of this job?
It's a good question. Nursing is very stressful, so it's important to have a good work-life balance. One of the ways that I handle the stress of work is listening to music a lot or playing music. I play piano, so that's been really therapeutic for me, as well as just taking vacations. And it's easy with a nurse's schedule to kind of work in a block and have all those days off in between without taking PTO, and just using that time to either just laying in bed and not moving if you've had a pretty rough couple nights of work, you don't want to move, you just kind of want to stay in bed, or actually like planning a fun trip, whether it's locally, driving distance away, or if you plan like a big trip out to Hawaii or something like that. You know, it's always fun to be able to work hard and then get to play hard too. It's really fun.
True. And I'm going to play off of that. I can talk for decades on end about mental health. It's really important, especially as a nurse. It's really important to take care of yourself, avoid burnout. Going on the vacation thing, I do have a lot of coworkers that never take vacations. They just work their butts off on end. And you can tell that they're very stressed, like working in the job. They can't separate their work-life balance because they're not helping their life balance. They're just focusing on work all the time. As well as nurses always picking up extra. I know I talked about this in another video, but I did pick up extra so much before my wedding, and I do love my job. I love my unit so much, but all those extra shifts burned me out so quick. So since my wedding in June, I have not picked up an extra shift, and I came back to loving my unit. So yeah, just pick up what you know you can. If you really need the money, just do it for, you know, maybe once or twice a month. Don't pick up every single week like I did, because 4-day, 12-hour shifts can really burn you out so quick. So yeah, it's really important to be relaxed whenever you get home. Whenever you get home, just think about your life balance. Don't think about work. Push that all aside. Take a relaxing bubble bath, light some candles, listen to some music, clean your house. If there's lots of clutter, that's a big thing that can kind of stress you out as well. Take vacations. Take your PTO. If you have 300 hours of PTO, like I know a lot of coworkers do, take it. Use it all for vacation.
I'll take it.
True. We love our PTO. Yes. So yeah, just try to, as much as you can, separate work from life, especially if you have kids. Focus on your family whenever you get home. Focus on your significant other, your boyfriend or husband.
Your cats.
Or your cats. But yeah.
Another really important thing to help with stress and with all the things at work that you see that affects you, I think, is having a good spiritual life, and just making sure that you're taking your time to read your Bible and do your devotionals and pray and spend time with God too, because I think that can really help keep you in a good, positive mindset, especially reminding you of your calling. And even though work can be really hard and sometimes it does really make you want to quit, sometimes you just have shifts that are just really, really bad, and you don't feel like you're a good nurse and you just don't want to do nursing anymore. But just taking that time to refresh your mind and your soul and reading the Bible and just reminding that it's a calling, and God can help you through anything, and He's using you for a greater purpose.
Amen. I love that. I totally agree with her. Whenever I don't read my devotional, I feel like I just have too much clutter on my mind and I don't know how to organize it or get rid of it. It just all piles up, but whenever I kind of just let it go, meditate, relax and read my Bible, read my devotional, it totally helps out my mindset and refreshes my mind, just like you said. We can totally do a whole video about nurse burnout and mental health as well. I feel like we always talk about it. It's really important to have a good friend to communicate to. It's really important to have a really good friend to kind of release all your stress and just talk about like nursing with or a significant other, things like that. So I guess that ends this video. Yeah, thank you for joining me. If you're thinking about picking an OB job or a pediatric job, I hope this video helped you kind of decide which career path you want to go to. Of course, nursing is an awesome job because you can switch to either or if you want to. You can do pediatrics first and go to OB, or go to OB and switch to pediatrics. That's the beauty of nursing. But yeah, we hope that this helped you. And if you guys have any questions, leave them in the comments and either one of us, I'll forward the questions to her so she can answer them. We will get back to you. But yeah, I hope this video helped you and thank you so much for watching. Subscribe! Woo! For more content. Yeah, so see you guys. Bye!